Dozens of asylum seekers held at the Manston Processing Centre in Kent have contracted diphtheria, with one man thought to have died from the disease. Concerns have been raised after reports suggest some had been moved to other parts of the UK without being properly screened. Joining us now is the GP, Dr. David Lloyd. Hello to you, Dr. Lloyd. It's always great to see you. Thanks for joining us. What is diphtheria?
Oh, diphtheria is a really horrid disease. I've never seen a case. I don't think any in my generation really have, but I remember my father talking about it. You get a huge white membrane going over the back of the throat, which means you can't breathe, and sometimes you need to have a tube put in. You also have a very swollen neck. They call it a bull neck, and you're very, very ill. And unless you get treatment very quickly, it can be a very deadly disease. There is a minor variant where people who are exposed for it for a long time get a skin condition too, and horrible rotten skin ulcers. So yes, it's a horrible disease. We haven't had it really in any quantities since the 1940s when we started vaccinating. So I guess the key thing is do make sure all your children are up to date with their vaccinations. You need five lots of vaccinations to keep diphtheria at bay. But this is a very hot political issue, and so you're asking me, I'm afraid, for medical things. So I don't dare say one way or the other, but some sides of this argument are saying that we're suddenly inundated with diphtheria. Others are saying that there's very little. But we all travel thousands of miles every year, and so we all have a chance of bringing this disease back from countries that don't vaccinate against diphtheria.
But if we are vaccinated against it, if I'm guessing most of the country is inoculated against diphtheria. Yeah. So how much of a risk is it for the general population?
Well, that's exactly right. So we rely on the vaccinations to keep up our immunity. But there is so little diphtheria circulating in the community, we don't have any natural immunity. So as we get older, that immunity can die down. And unless we've had the full course, we are at risk. So this is yet another plug, I'm afraid, for mothers and fathers getting their children vaccinated and completing the whole course. If we meet people who've come from another country, particularly refugees, and we're not sure of their vaccination history, we will give them a complete course to let them catch up.
Are you suggesting that older people should potentially be going to the doctor to say, oh, I'm not sure if I've had all my inoculations?
No, I'm not. No, I'm just saying that there is a theoretical dropping off in immunity. But I don't think you're going to come across much diphtheria, whatever age you are. It just means that us doctors have got to just put this in the list of things that cause sore throats. And once you look in someone's throat and you see this infection, even me could diagnose diphtheria, I think. Yeah.
Talk to me about scabies. Apparently that is another subject that we're hearing quite a lot about at the moment. How worried should we be about scabies?
Well, it's not deadly. It just causes a ferocious itch. And unless you get the right treatment, you do itch for weeks and weeks and months for months. But there is very effective treatment for it. And as long as you obey the rules and apply the ointment, you make a complete recovery. But yes, again, crowding in unsanitary conditions can spread scabies like wildfire. But you can't catch it unless you sleep in the sheets of somebody who's caught it or in very close contact with them. So you've got to be pretty close and pretty intimate to catch it otherwise.
Okay, COVID. Where are we with COVID at the moment? It seems like people are dropping like flies.
Well, of course we are, because it's circulating so fast in the community and we can't keep up with the variants. But yes, everybody's got to be very vigilant. And if you're suspecting it, get tested. And if you're at risk, the key thing is dial 119, because we've got a fantastic system now for getting the antibody serums and the NMABs to people who are at risk from getting complications of COVID. And the system is very slick now. So any doubts at all, ring 119 and we will sort you out.
But are you finding that people are being as poorly with COVID as they were previously?
No, it's just like a sort of flu thing now. So we've got this triple demic, as I said last week. So we've got everybody getting flu-like illnesses from the three main infections that are circulating in the community nowadays. But there are people with lots of risk factors who are immunosuppressed who will get complications. And I hopefully have had a full course of vaccines, but I hopefully will contact the right authorities so they can get the right treatment. And we have
Okay,
very
Doctor.
good treatment.
We must let you go, but thanks for your expertise as always.
Thank you.